Good afternoon and welcome to the U.S. Chamber Foundation's Path Forward. If you're a returning viewer, we're glad to see you, and if you're new to the program, welcome. If you are returning, then you're familiar with one of the refrains on Path Forward, which has been that help is coming, that the end is near, and that private sector was leading the way. We heard from Dr. Fauci, from the Surgeon General. We heard from Dr. Redfield. We heard from the Gateses that science was coming to our rescue. And after 10 long months, this is certainly coming true. Over the past few weeks, we have seen the culmination of months of hard work, dedication, and collaboration from the pharmaceutical industry. Last week, the FDA granted emergency authorization for Pfizer's COVID-19 vaccine, with more likely on the way, Moderna's as early as this week. The development and delivery of a safe and effective vaccine at an unprecedented speed is a historic example of the power of private industry to change the world for better. But we know that this is just a first step. Now we need to ensure that vaccines are quickly, safely, and equitably distributed across our society. And of course, we all have a lot of questions. How will vaccine distribution plans be implemented? What role will the private sector play in that process? And what does all of this mean for getting our workplaces and our lives back to normal? We have a terrific lineup of speakers today to help us answer those questions and more. We were delighted earlier today to be joined by Arkansas Governor Asa Hutchinson. Governor Hutchinson is vice chairman of the National Governors Association, and he's been a leader in our nation's COVID-19 response at the really important and critical statewide level. Also joining us is Dr. Troy Brennan, who is the Chief Medical Officer of CVS Health. Dr. Brennan was one of our first Path Forward guests back in April for an episode that we did on testing, and we're delighted to welcome him back as our very first repeat guest. We're also pleased to be joined by Dr. Kevin Ban, who is the Chief Medical Officer for Walgreens. Finally, Wes Wheeler, President of UPS Healthcare, will round out the program. As usual, we'll take your questions at the end. Please submit them in the chat feature as we go along. And first, let's roll the interview that we did with Governor Hutchinson earlier today. Governor, thank you so much for being with us today. Tell us, how are the people of Arkansas faring?
Well, thank you, Suzanne. It is good to be with you, and thank you for the Chamber's great leadership during this difficult time. Here in Arkansas, it's been tough on Arkansans, just like it's been tough on people across the country, but they're resilient. They've responded very well. And one thing that we've done is that we've really kept our economy open. We didn't close it down. So we're minimizing the number of people that are out of work. And our cases right now have flattened out week over week. Now they're flattening out at too high of a level, and we've got to get that down. But the people of Arkansas have responded very well. And we have some restrictions in terms of the space capacity for indoor events and restaurants, but beyond that, we're open. We recognize that these are jobs that mean a lot to families, that they're dependent upon that. And so because of that, we have a good balance here in this state, and we're working very hard to reduce the caseload. One of the things that we really watch, of course, is our hospitalizations, and we're doing a much better job of using our therapeutics to diminish the length of stay in a hospital, to get people well earlier. And because of that, and because of the great staff at the hospitals, we're actually not over capacity, but we're making the steps necessary to make sure that we can meet the needs of both our COVID patients and those that have elective surgery and other health needs. And so we're balancing that. We're trying to get through it, and we're so delighted that a vaccine is on the horizon. Well, it's here, and that we hopefully will have another one on the horizon soon.
Thank you for that. You know, it's interesting to hear you talk about the balance, right? Both the tension between what needs to be closed and what needs to be open, but also just thinking about all of the balancing acts that all of the nation's governors are dealing with right now. And it's one of the reasons the chamber is so delighted to see the bipartisan cooperation that's taking place. So as the new vice chairman of the National Governors Association, what can you tell us about how the governors are working together to both get us back to health and get us back to work?
Well, the first thing is the governors have had a lead role in responding to the pandemic. And I think the governors all have made decisions for their individual states, their unique circumstances, trying to follow the science. Sometimes it leads to different conclusions, but the governors have had an incredible, effective means of communication, both within ourselves in a bipartisan way, but also in a way that we communicate to our federal partners. Yesterday is a good example that the National Governors Association had a call with President-elect Biden and his new COVID team, and we relayed some of our concerns, things that we saw need to be done that are right, and what Congress needs to do to help fill the gaps in the needs of the state. And so there's been an effective means of communication, which is helpful to me just to know what another governor is facing, what kind of best practice they're using, what challenge there is, how they're handling that. But also we've helped shape national policy, which I'm so delighted with the partnership that we've had in the Trump administration. And hopefully we'll be able to continue that in the next administration as well. From yesterday's call, I feel very confident that the new administration will be listening to the governors, working with us. And I push that we need to have a seamless transfer of our current Operation Warp Speed, the capability that the private sector has developed in vaccines and the distribution systems. That we're off to a good start on. We just need to be able to continue that.
You know, we couldn't agree more about the leadership you and the governors have really provided in this pandemic. And we hear about it a lot from the state and local chambers. So you'll continue to receive our appreciation and pass it on to your colleagues. Shifting gears a little bit, you just brought up the vaccine. What do you want people in your state and really all the states to understand about the COVID-19 vaccine?
Well, it's really interesting. Everybody has followed the development of the vaccine. I think they had nervousness about it naturally. Some of it is based upon the history of how we've had science experiment with minority populations in our history. And so there's been some nervousness about it, but it's interesting to me that the confidence is building. I think it's building because they understand that the FDA has a world-class gold standard for review. The people are gaining confidence that those standards have been met. Secondly, we received our first vaccine at 8:10 a.m. on Monday, and by the afternoon we were doing vaccinations. And of course, this was very visible on the media, and so that helped build confidence as well, having the nurses and explain how important this is, how they believe in it. It's important for our society. And so you can see from the polling information that the confidence level is increasing. And I want the people of Arkansas and the nation to know that they should have confidence in the vaccine. It is necessary to get us out of this pandemic. And thirdly, we're going to set the example at the right time that the First Lady, Susan, and myself, we will be taking the vaccine because we have confidence in it and we know how important that is. When leaders do that, whenever our healthcare professionals do that, and they have the experience of successful vaccine deployment among essential workers, the confidence will just continue to increase.
It's what you're saying is so important. And I think one of the things we've tried to do on this program is underline that the warp speed had to do with getting through the safety protocols quickly, not skipping them, right? And doing a lot of things simultaneously in order to get the vaccine distributed, going through the approval process while you were ramping up manufacturing, while you were making a distribution plan instead of a stepped process, which we hope will lead to confidence too. So I think you're right that confidence is increasing, optimism is increasing, but so is curiosity, right? And so the questions that on everybody's mind are kind of, when do you think we'll start administering the vaccine outside of healthcare workers and get to essential workers?
Well, that is a great question, and it's encouraging that the public is starting to ask those questions and saying, when is it going to get to me? When is it going to get to my friends and neighbors and our elderly family members? And so our first shipment did go to our hospitals and our pharmacies for use among our healthcare workers. So that, as a practical matter, was the first priority, partly because our long-term care facilities were not quite as equipped to handle the storage requirements, the temperature requirements of the Pfizer vaccine. There was a little more comfort with what they hope will be the Moderna vaccine that will be approved, we hope, by the FDA today or later this week. And so that's the next step, is all the staff and the residents of our long-term care facilities. We've had too many deaths that have arisen out of that elderly population that has underlying conditions in many instances. And so we want to get that vaccine as quickly to them as possible. And so I would expect next week that we will be vaccinating our residents in our long-term care facilities as well as the staff. And as the shipments come, it will continue to go down the list of priorities that we have. And it all depends upon our production capability of the private sector, which I have confidence in that will continue to increase in the days and weeks ahead.
When we interviewed Dr. Fauci on this program, he said there was a light at the end of the tunnel and the private sector was leading the way. And you can imagine that the Chamber of Commerce and the Chamber Foundation loved hearing that. So you're speaking to largely a business audience. And I think that business owners and executives in the audience and the chamber executives are really curious about how states are even starting to think about what is an essential worker. We know that that'll be a state and local decision. They're curious what you could share about what's framing that debate and discussion in your state.
Well, that's something that we're wrestling with every day. And if you look back early on in the pandemic, essential workers could continue to do their work even though there were lockdown orders or shelter in place in different states. And so a lot of work was put into defining essential workers, and it started with our Homeland Security definition of critical infrastructure and essential industries in our country. So we've been down that road before, and it's somewhat well defined. I think it's going to be a little bit more challenging because we're not going to have enough vaccines immediately for all of our essential workers, as has been previously defined. And so then you have to prioritize within the essential workers or figure out exactly the criteria as to how it's going to be administered. We're fortunate that Dr. Jose Romero, who is our Secretary of Health in Arkansas, is also on the CDC Advisory Committee. In fact, he's chairman of it, that will be meeting this week to more carefully define the different sequences and priorities in vaccination. Now, that committee will make recommendations to the governors, and we will try to follow those, but there's going to be unique things in different states that's going to make adjustments to it. Whenever you look at Arkansas, for example, both in terms of equity, but also in terms of essential workers, our poultry workers, they were hit very hard early on in the pandemic. They are largely a minority population that works in the poultry plants. Those are ones that we believe should have a high priority as essential workers because they're part of our food supply and they are at risk in that environment. So those will be, that's an example in Arkansas of who would be a most likely priority essential worker. But we want to have some fair standards out there that are transparent. We've also got to look, even though we're doing our nursing homes early on, who's going to be next in terms of the elderly population, and where does that fit into our prison population that are in congregate facilities that are at risk as well. And so there's many needs that are out there, and there's going to, the first shipment was easy because it's going to our healthcare workers, and that's something that has unity of opinion on. But as you get more and more vaccines coming into the supply chain, there's going to be increasing scrutiny and debate as to how that's going to be allocated. And that's why we need to get a regular supply coming in so we can move through those priorities very quickly to get to all the populations that are at risk or in serious need.
And I think it's so important that people like you, leaders like you, are on programs like this so that the public can hear the wisdom and the complex, the wisdom you're bringing, the complex decision making, how hard this is. I think you're right. It's good news that the public wants to know where they are in line, but we need to understand how complicated these issues are. And so moving from the vaccine for a minute, I was really interested to hear more about this COVID collaborative that you and about a dozen governors have signed on to, because I know where I live in McLean, Virginia, the Virginia stats and the Virginia rules are somewhat less important to me or even relevant to me than DC, right? It's just right here. And so this virus that doesn't know boundaries feels really important. So question for you about what do you think about this COVID collaborative and about kind of working cross-border on this?
Well, there's been a couple of instances in which the governors have united together to try to solve some problems. One of the first ones was in the procurement of testing supplies that midway through the pandemic and early on was in short supply. We were all struggling, and so we tried to increase our purchasing power by having governors join a coalition to strengthen that. And that has been a good backstop for us. But the coalition that you're referring to is really broader than that, where we sign on to a list of principles and priorities. And part of it is, what are our measuring sticks? How can we know when schools should be open, whenever what's the criteria for success, and whether we should have to put more restrictions on or lift restrictions. And so that's an ongoing discussion, but it's been very beneficial to have the states come together and say, let's see if we can't unite behind some priorities, some principles as we go through this pandemic. And one of those, of course, being what's the criteria to lift restrictions again? Should it be more than adequate hospital space, which should be an important part of the criteria? Should it be the number of cases and our testing capacity? All of those we try to measure to make sure that those are some of the standards that we follow as we look in the future and when we'll be lifting restrictions and opening up our economy even more. As I've pointed out, some of the toughest decisions comes to whenever we had to put restrictions on. The second set of very difficult decisions is when we start lifting those same restrictions. When do you open up restaurants? Right now, we're limited in capacity to 2/3, which allows our restaurants to survive, but when are we going to be in a position to lift them to full space? And the same thing in our gyms. Well, we ought to have discussions among the states as to what are good criteria to share information, and that's part of this coalition that we've developed.
I think that's so important, right? We can all look back to right around March 13th, and it felt like things shut down on a dime, but they're not going to open up on a dime, Right. And so, again, getting back to this theme of confidence, getting the public to have confidence in these decisions means bringing these discussions to light and getting people ready for these decisions. So, interesting conversation just then about how governors are collaborating. Can you talk a little bit about the coordination between federal and state government? Do you feel the governors are getting all the information they need about the vaccine and more broadly about COVID-19?
The short answer is yes. I think there's been an extraordinary and historic level of communication between our federal partners and the governors. During the Trump administration, the vice president has led the coronavirus task force. He's done an incredible job. And knowing that I can pick up the phone, which I've done on a number of occasions, to whether it's Dr. Fauci or Dr. Birx or to the vice president, or more recently into the supply chain and how the vaccines are being distributed. That's been an incredible benefit. We've had regular communications and very honest dialogue, and we've been able to address problems as a result of that. You know, early on, it was testing capacity, and it was a very frustrating point. And we were relying upon federal shipments of our testing supplies. It wasn't perfect, but whenever there was a problem, they addressed those. And now it is in the vaccine distribution. And I just have to say hats off to both the administration, but also to the private sector. It is an example of public-private partnership that is proven to be so helpful in getting the vaccine out quickly. Whenever you think about the short time, first of all, to get the vaccine approved and developed in record time, and then once it was approved, to have the logistics already in place with the private sector, who, by the way, was on the telephone to me a week in advance saying, we're going to be responsible for shipments. If there's a problem, here we are. This is how it's going to work. So the partnership, federal level and with the private sector, has been extraordinary. What I urged the incoming Biden administration is that there has to be a seamless transfer. What we're seeing right now is working, and what we have to have is a continued supply chain that is reliable in terms of vaccine production, the delivery, and the steadiness of that. And so the last thing you want is a stumble and a handoff for this incredible process that we're going through that is so essential for the health and saving lives across our country. But the communication has been terrific. I expect it to continue at that level. And because everybody is thinking, what can we do to save lives and to get out of this pandemic with our economy not totally in tatters, but that we can rebuild very quickly.
Well, I, of course, join you in applauding the private sector's role in this, but really the cross collaboration of local government, state government, federal government, the private sector, the NGOs, and there is reason to feel good about what this cooperation has led to, and maybe even hope that it could lead to some bipartisan working together next round on infrastructure and other things our country so desperately needs. Governor, I know you have a busy day. Let me ask you a final question as we head into the holiday season here. What gives you hope or optimism as we head into what will still be a pretty uncertain winter?
Well, it is a time of hope. And what gives me the greatest hope, first of all, is the example that's been set by our healthcare workers who have now been on the front lines, really staring death in the eye through the patient, saving life one person at a time. And they've been at it for 9-10 months, and they're still at it. And because of their dedication, it's inspiring and gives me hope. But secondly, I'm encouraged by Congress in a bipartisan way in the last week, coming together and saying, we're not going home until we get relief for the American businessman. We get relief for our hospitals and relief for our testing and vaccination capacity in this country. And so that encouraged me to see people coming together across the aisle, addressing a serious and urgent matter in our country. But it gives me hope as we enter next year that this pattern will be able to continue. And then, of course, the private sector and their capabilities. When are we going to have broad vaccination among the population? Well, it's likely to be in spring. But guess what? The private sector and their capabilities can surprise us every day. And just as in wartime efforts, where they accelerated their construction of manufacturing facilities, that's going to be happening every day. And the private sector is going to make the difference, both in terms of how many companies will be producing vaccine, the delivery schedules that we have. It gives me hope because of the free enterprise system in America and because of the strength of the private sector, that we're actually going to be able to accelerate even to a greater extent the development, the production, and the delivery of those vaccines to lives across country that need it very deeply.
Well, listen, we absolutely could not agree more. And let me add that it gives me confidence and optimism to hear wisdom and deliberate judgment and thoughtfulness from leaders like you, Governor. So thank you for that. Best wishes for the holidays to you and the First Lady and your family and all the citizens and businesses and chambers across your great state. Thank you for today.
Thank you, Suzanne. Good to be with you.
Okay, so turning to Dr. Troy Brennan from CVS, where he's the Chief Medical Officer. When you were first with us back in April, boy, a vaccine just seemed a long way off, and yet here we are. Question for you that on a lot of people's mind, which is how did the vaccine come together so quickly and safely? Can you talk us through that?
Well, I think it was a combination of factors. You have to give Operation Warp Speed credit because they did allow people to go ahead and manufacture without the risk that they would have an unsuccessful vaccine. And they also put together the various different suppliers that needed to come up with the materials that were necessary. Literally billions of syringes and special glass to be able to hold the vaccines. But it was really the incentives for the biotechnology companies that produce the vaccines that was critically important. And then I think that the manufacturers themselves moved very quickly. They carefully designed their studies. They built the studies in a large size. So, they're carrying 30, 40,000 subjects, and they went into the teeth of a pandemic. So there was going to be a large number of cases occurring, which makes it a lot different than other vaccines where the cases would be potentially sort of more sporadic and you had to do a longer testing period. They also have been fastidious about gathering information on safety and have been able to sort of reassure us that the vaccines look safe. And then finally, I think it's just a matter of an A+ for the technology. We've got 2 vaccines now with Moderna about ready to be approved using a messenger RNA technology, which is basically new technology for vaccines. And the next 2 will be using adenoviruses. And again, those are relatively sort of new technologies. So we're taking advantage of tremendous progress in molecular biology over the course of the last 10 years in order to get these in place. But you really have to give kudos to everyone who was involved, from Warp Speed to the manufacturers.
I appreciate that response. And as you just heard me say to the governor, I think getting this story out will be really important to improving the public confidence in this vaccine. And so related to that, what else do you think we have to do to build public trust?
Well, I think it's like anything else. You've got between, depending on sort of who you are and how you classify things, somewhere in our information, somewhere between 25 and 30% of Black Americans are saying that they don't want to get the vaccine. Same thing with Native Americans. It's lower in other ethnic groups. So I think that it's reasonable for people to be concerned that perhaps their race hasn't always been treated fairly with regard to both biomedical research and generally speaking. So I think there has to be a heavy emphasis on equity. And quite frankly, some of the populations that seem not to want to get the vaccine are those that have been hit the hardest. So we need a lot of leadership there. And I think the vice president and the president-elect and the vice president-elect, people like that, getting vaccinated and making it public that they're doing it and that they're not afraid of this vaccine and it's the right thing to do. These vaccines are getting the vaccine is definitely a much safer course than continuing to expose yourself to the possibility of being infected. Is going to be incredibly important. So I know there are lots of organizations coming together, including both the state and the federal governments, to try to make that point and get that message out. But I think it's one that we all have to reiterate. And then behind that, I would say, and hopefully we're not all so cynical that this doesn't resonate, which is that there's a civic duty. Everybody who gets a vaccine is decreasing themselves as a potential vector, perhaps eliminating themselves as a potential vector for the disease. And the more people that are vaccinated, the fewer vectors there are, the more likely is that we can make this particular pandemic go away completely. So when you get vaccinated, you're not only doing something for yourself, but you're doing something for your loved ones and for all the rest of the people who are citizens in your country.
Such an important message, and we'll promise to be your partners in continuing to get that out. So moving to CVS, talk to us about who will be the first recipients of CVS's doses?
Well, we, like Walgreens, I know Dr. Bond's going to talk to you very soon, have been selected by Operation Warp Speed to conduct the vaccine administration in long-term care facilities, skilled nursing facilities, assisted living facilities. And that's about to start. We'll be doing some test dosing on Friday and through the weekend. And then we officially start with maybe a dozen states on the 21st. Another wave goes out the 28th. And what we'll be doing is basically distributing the Pfizer vaccine by and large to depots spread throughout the states. And then from those states, teams will be going out to the individual facilities and vaccinating the people who have given consent that they want to be vaccinated, as well as any workers at those facilities who wish to be vaccinated. And we will vaccinate our vaccinators at that time as well, because we want to make sure that they stay healthy and can continue this process. And we'll be visiting these skilled nursing facilities 3 different times over the course of the next 6 to 9 weeks, doing the second follow-up vaccination, catching any people who didn't get vaccinated the first time, and staggering the vaccination of the staff. So we think that over the course of a 9 to 12-week period of time, we'll be able to take care of all of those facilities who have opted for us. Amongst the 70,000 or so now facilities that they're looking at, I think over 40,000 of them are going to have us do that. So we have to make sure that we get out and get that done as soon as possible. At the same time, obviously, healthcare workers, including many of the healthcare workers who work for us, will be getting vaccinated. And then it's going to turn over to this set of decisions about who the essential workers are.
As you can imagine, we're having a lot of conversations about that, and there's a lot of curiosity about, when do you imagine an average citizen can walk into CVS and get this vaccine?
Well, there's a lot of average citizens amongst the essential workers. The governor's right. We've got a change of management occurring sometime just after the middle of January. So we've been working with Operation Warp Speed and the current administration very carefully. We've been in discussions with the new administration. My own view on this is that I think that the best and easiest place for people to get these vaccinations is going to be the retail pharmacies. Operation Warp Speed's already contracted with, I think, 16 different pharmacy chains. I know from our point of view, once we gear up in the pharmacy, we feel like we can give 20 to 25 million doses per month. So if you say that the rest of the pharmacies would be 4 to 5 times that, the country really has the capacity to get 100, 125, 150 million individual vaccinations. In most of the situations, people are going to need 2 of those done per month. So I would go for speed. And as a result of that, try to get the essential workers beginning to get vaccinated as soon as possible, at least in the pharmacies. And I would hope that that would begin. My own hope, I may be ahead of myself a little bit here, is that something that could be occurring by mid-February, the end of February. And then we go through the essential workers, address the people who are over 65 and have morbidities, and then the general population. But there's no reason why this can't go relatively rapidly. And the sooner we get a certain critical mass of people vaccinated, then we begin to see the virus spread begin to stop, and we can begin to relax and return to our usual life, and we can get out from underneath this horrible morbidity and mortality we've been living with for the last 9 months.
What a wonderful message going into the new year. Before we bring the next panelist in, let me switch topics quickly. When you were last with us in April, we talked a lot about testing. How are you feeling now about testing supplies and kind of where we are and what still needs to be done?
Well, when we met, so many months ago, we remember we were talking about by December, how many tests will we have by December? And we hoped it would be as many as 30 million and perhaps more. We're going to be way over that. It'll be more like 60 to 90 million tests in the month of December. So there's a lot of testing capacity out there. We have 5,000 locations that are doing testing today, and many others have contributed as well. I'm still not sure it's the kind of testing that the public health experts would call for. What they'd really like would be at-home tests that people could take that would be very inexpensive, and that they could use anytime that they either feel like they're exposed or begin to sort of develop symptoms. Those are beginning to sort of come down the line. So I think we'll be seeing a shift towards that as we get into the spring, and that'll make the testing format, I think, a lot more effective because people will be able to make immediate decisions as to whether or not they should be isolating themselves or understanding that they are infected.
Thank you so much. We'll be back with some audience questions, but let me bring in Dr. Ban from Walgreens right now. Thank you so much for being with us. Question for you about, as Walgreens, what has Walgreens learned from a massive flu vaccine distribution that's applicable here for COVID-19?
In fact, I think it's important. First of all, Suzanne, thanks for having me on today. I think it's important for everyone to realize that we don't start from scratch here, that we have really deep infrastructure in retail pharmacy to deliver, on this promise. And what I mean by that is over the course of the last 15 years, Walgreens has been building out its vaccine program. And so we have a lot of experience, and everyone knows this, is you can go into retail pharmacy and get your vaccine. And now over the course of the flu season during the pandemic, we've been very careful to make sure that we build processes such that not only the people who are getting the vaccines are safe, but so are our team members. So we do the basic things. We temperature check, we make sure that we symptom check. And then it's important that not only the patient, but also the pharmacists wear masks. On top of that, our pharmacists wear shields, and then we're very careful to clean after that. The flu, I think of the flu season that we're in right now, and then really the 2009 H1N1 flu pandemic. I'll remind everyone that is almost like a dry run for us as to how we need to act during this pandemic. So we feel really comfortable that we're positioned to be able to, again, start in these long-term care facilities, and then, as Dr. Brennan explained, scale that out across the country.
So just a quick PSA to remind our audience to get your flu shot. And if you don't know where to get one, go to vaccinefinder.org to find the flu shot near you. Okay, but back to Walgreens for a minute. This seems like it takes a lot of people. And so do you feel like you have enough pharmacists and technicians to be ready to go?
We do. We feel really confident about our staffing. Just to give you an idea, Suzanne, over the course of the last 5 years, we've performed over 150,000 flu clinics that are very similar to the ones that we're about to start in these long-term care facilities. So we do feel confident that we're staffed appropriately. Having said that, COVID has turned into a certain amount of service or new services for Walgreens, in that we are now doing COVID testing and we're about to expand our vaccine program. So the most important thing for us is that we want to make sure that our pharmacy teams, that our pharmacists are very well supported, they have the right resources. So we've been hiring and so we feel confident about the infrastructure, as I mentioned, but we're adding to that to be sure that we're prepared for what we're about to do here.
There's been some conversation about rural areas and, are there enough healthcare workers and pharmacists and technicians in rural areas? And we're also getting an audience question that relates to that, which is, will adding Moderna's vaccine to the available supply boost rural access because it's shipped in smaller batches and seems to be easier to store?
Well, this is something that is really central and core to sort of the Walgreens DNA. We care a great deal about underserved areas. Again, Dr. Brennan mentioned a lot of the pressure that's been put on minority communities. And so in building out our testing sites for COVID, we were very careful to be sure that we were serving both rural and underserved communities, so vulnerable communities. Over 70% of our testing sites are in those underserved communities. And our intention then is to really lean into that. And so while we're doing testing there now, we want to make sure that we bring more resources to those areas. About 80% of Americans live within 5 miles of a Walgreens, but that's just not enough. There are areas where there can be great distances. So we intend throughout the vaccination program to add mobile testing. We're going to do many offsite clinics, and we're going to do everything we can to be sure that some of the folks who've been hit hardest by the pandemic, people living in vulnerable communities and minorities, get all the resources that they need.
So let me switch topics for just a second to some of the logistics of this. So both the Pfizer and the Moderna vaccine require 2 doses. What happens if someone skips one?
Yeah, it's important that people really understand. And in fact, I'll take a step back, Suzanne, there and say that education is key around this. We've worked really hard on distribution and the administration of the vaccine, but the education component of this is paramount now. Yes, both the Pfizer vaccine and the Moderna vaccine both require 2 doses. It's important for people to know that. What we'll do is we will use our infrastructure. When you have 2 doses, it's referred to as a series vaccine, and we already provide series vaccines. So this is something that we know how to do. We have the right infrastructure, first of all, with protocols and processes that our pharmacist teams use, but you also need the technology infrastructure to do it. So the first shot, for example, or I should say 21 days after the first shot for Pfizer, and then 28 days after the second shot for Moderna, people will need to come back. And what we're going to do is make sure that we use our infrastructure. What does that mean? Well, people will get just a reminder card when they're vaccinated, and then we'll use text and email. We'll even phone people to make sure that they get that second dose. And then when they have, we're going to close the loop with their primary care doctors. So that's our protocol. That's what we do. When I refer to all the infrastructure that we have and the confidence we have in our ability to do it, it's because it's baked into a process that we already have.
Thankfully, right? I mean, and I think it was important, as you heard me say to the governor, that when we talk about why this is speedy, it's not because steps are being skipped. It's not because it's not safe or effective. It's because of the experience, the distribution, and so many steps being taken contemporaneously. Let me ask you a question before we pull in our final panelist. Where do you think we are in fighting this pandemic in 6 months?
So, when I think about the obstacles here, it's felt like we've been walking into this COVID forest almost for 9 months. Now, for the first time, it feels like we're starting to walk out of the COVID forest. But this won't be a light switch that gets turned on. It's more like a dimmer switch. And so we're going to start with those folks who are on the front lines of the pandemic, healthcare workers, and like CVS, tomorrow we're beginning to vaccinate in long-term care facilities, and we'll scale that out next week. So these are all tools that are allowing us to get out of this pandemic. It wouldn't be proper unless we say the rules still matter: hand hygiene, social distancing, and masks. We need to lean into that now. You talked about testing with Dr. Brennan. It's really important, especially that testing, if we could get to the point where people could test at home, and therefore, if they're positive, stay at home. That would have a huge impact. And then, of course, we have the vaccine. I should mention that I followed this vaccine really closely. All the phase 1, phase 2, and phase 3 data looks exceptionally good. Everyone knows about the efficacy. The safety is very, very good. And so, we have yet another arrow in our quiver. So put all of those things together, following the rules, testing, and the vaccine, and I'm hopeful within the next 6 months we're walking out of this forest and we start to return to life as we remember it.
I think that's what we're all hoping for, right? And it does feel like we're getting there, that there is a light at the end of the tunnel, or we're walking out of the forest, whatever optimistic metaphor we want to use. I want to come back and ask you about testing question in a minute. But first, let's bring in Wes Wheeler from UPS Healthcare. Thank you so much for being with us today.
Hi, Susan. Thanks for having me.
Absolutely. So the logistics required in getting this vaccine to 50 states, and with the shipping requirements that it takes, I mean, it just feels like it's overwhelming. What has prepared UPS to do this?
Well, of course, we do this every day, and we're well above our average 25 million packages a day. We're in the middle of peak season. We're coming up on our busiest week ever, and of course, that's going to be also the busiest week for delivering the vaccine. So it's kind of a perfect storm. And speaking of that, we have a nor'easter running through the Northeast right now, and we're still delivering our fourth wave of vaccines along with all the other states, and 4 of the outlying Pacific Islands as well. So we are on the move. It's been an incredible honor to be doing this. I know we're the last line here after all the development work that's been done and all the preparation work that's been done. It's been 4 or 5 months in the making. But we're on the move, and we're prepared, and we're ready for Moderna.
So as we look across, you just said you're last in the line, as we look across all of the actors that it's taken to get this done, can you give us a kind of peek inside the tent and explain how you're all working together? I mean, you heard the governor compliment the logistics and distribution companies for the way that they've been communicating, but how has that worked?
Well, I appreciated the governor mentioning the logistics. It was actually FedEx that delivered to Arkansas, but that wasn't one of our states. But no, I appreciated that. Inside the tent. So this started way back with FEMA. We had a big role to play with moving PPE into the country. Way back in February, March, we delivered 24 million pounds of PPE into the U.S. from various places, mainly China. That gave us a very good insight in how the government was working. We had an embedded professional logistician based in FEMA's headquarters during that whole period of time, and it gave us a lot of insight in how they make decisions. But then, of course, we pivot into past the testing, which we can come back to, into vaccines. We did the clinical trials for Pfizer. It gave us a lot of insight about how to handle the vaccine. And then, of course, we got the call about Operation Warp Speed. I knew that HHS would be involved in some way in logistics, but then they launched this new operation, and we've come to be friends. We work with FedEx and McKesson every day. General Perna, I have a direct line to General Perna. I talk to him probably at least once or twice a day. It's an amazing operation. They've built a bunker in the HHS building in Washington that looks a lot like what you'd see at NASA. And they've got guys in Army boots running around with camouflage, taking this very, very seriously as their mission. And we're a key part of it.
So back to vaccine distribution for a second. We've heard so much about the cold storage requirements of this vaccine, and we have a lot of audience questions and member questions about, did you already have the cold chain solutions that you needed, or was this an additional investment?
So, like Dr. Ban said, I've been tracking these vaccines. I'm a pharma guy. I've been in pharmaceuticals for 30 years. I've been tracking the phase 1 trials all the way through, watching the same data. And we knew very, very early on, especially as we got into the Pfizer trial, that we were going to be needing a lot of cold chain capacity, and especially deep, ultra cold capacity at -70 or at that time, we thought -80. We went ahead and pre-invested in a freezer farm, both in the Netherlands and also in Louisville, near our command center. We built a command center. We built a dry ice manufacturing operation in Louisville, so we can actually make 24,000 pounds a day of dry ice. We started off this week at the launch with 100,000 pounds of dry ice on hand. So we are replenishing every vaccine delivery a day later. So all of this cold chain stuff came up early, 4 or 5 months ago, when we first started tracking all the vaccines. And of course, we knew Moderna was back and forth between -70, -20. They're at -20 now. The next vaccines coming through are either -20, and then we have a couple that are coming at 2 to 8, which is more like a flu vaccine. But yes, we've been building a lot of capacity ready for this, and we are worldwide now with capacity available.
I love this theme that we've been hearing all day, that all of this planning has been taking place contemporaneously to be ready for this moment. I guess I'm two competing thoughts are in my head, and I'm hoping you can pick the winner. One is that as more vaccines come online, that could increase the logistical challenges. On the other hand, maybe we'll be through the nor'easters and the holiday rush. And so how are you thinking about future demand?
We handle a lot of volume, and we've said this in the media in the last several days that we are handling the vaccines in our network. It's coming through our normal network. It's flowing through Louisville, our World Port facility. As we get more global demand, we'll be running a lot of that through our Cologne, Germany hub. But it's capacity-wise, this is not a real issue. We have tracking devices. We're giving priority. We actually have a GPS tracker that we use. We also have a Premier Gold Silver Tag that tags every shipment, gives it priority in the system. So anybody that's concerned about their Christmas presents running in the same vehicle or the same aircraft as vaccine should not worry. We give priority to all the vaccine shipments. And we have plenty of capacity out there. We're already talking to the other companies about what they need in terms of storage, temperature, capacity, pre-positioning in certain countries, packaging materials that are available and required, and also dry ice. So we're well prepared for this, even in the winter season.
So a last question for you before I bring everybody on for a couple audience questions. You're also a large employer, right? And you must be thinking about vaccinating your workforce, what your role is in that. And so as you think about employee messaging about the efficacy and safety of the vaccine, how are you thinking about that from an employer's perspective?
I think it started with testing, to go back to the conversation with both our CVS and Walgreens panelists. So we started very early on shipping into the U.S. from China, and we found that we had to protect our pilots. The biggest problem we have was protecting our pilots. The pilots flowing into China and out of China had to be tested with the really deep nasal swab, which was actually becoming a problem health-wise for some. It was starting to hurt. They had to do it every day. And so we got used to the fact that we were going to have to start testing our pilots, and we're still testing them now. In fact, even with the pandemic coming back in a big way, we're testing pilots even more now than we were before. In terms of vaccinations, we don't have a designation yet. We're not, as far as I know, we're not prioritized yet. We're waiting for Operation Warp Speed to tell us. And in the meantime, we're delivering to all 50 states in the order that they're giving us.
All right, well, let's bring in all the panelists for a few minutes here. We have a lot of audience questions. Dr. Brennan, I'm going to come back to you first. Here's an audience question. Should you contact your pharmacy or healthcare provider to be put on a list now if you're older than 65 or have underlying conditions?
Well, you can contact your primary care physician, but there's no lists now. We haven't gotten to that point yet. As I think the governor said, we're sort of waiting for CDC advisory about the next step with regard to sort of the essential workers. That time will come, and it's going to be, all this stuff. We're all very confident. All three of us are very confident, but we all know we're going to have sort of logistical problems as we move forward, and there's going to be sort of back and forth. But I think that the way we have to look at this is going to be a relatively fast process. Once we get geared up, it's going to be sort of a 4 or 5 month process. And so I think people just have to understand that there may be the possibility you get put on a list and you have to wait 2 or 3 weeks before you get a vaccine. But that's a relatively short period of time, given that we've been dealing with this thing for 9 months. But it's too early to be trying to put yourself on a list, I think.
That's remarkable. And it was so, I don't know, you're all nodding at the same time at the length of this process. And I think it's so reassuring. I think the mom in me came out thinking with a sense of relief, I have to admit. But Dr. Ben, let me go to you, because I think some of these audience questions, I think let me try to put this into one phrase. I think everyone, there's robust support for assisted living facilities, for healthcare workers, for essential workers, certainly to be at the front of the line, right? And I think people don't want to sound selfish when they say, okay, I understand all that, but when can I get it? Or when can my mom get it? Or what does this look like? And so people are really trying to understand how long they have to be patient, and without sounding selfish and asking. And so the question that we're getting, in part, we get it in a lot of different ways. One of the ways we're seeing it in the audience question is, okay, so it's been reported there's an excess amount, about 5 doses in each vial of Pfizer's vaccine, with an estimated 40% increase overall. How many doses is that? Does that mean we have more vaccines available than we think?
Right. So first of all, I think where possible, we try to be transparent. And so I'm going to pick up on what Dr. Brennan said earlier, which is we think we have about 8 to 10, maybe even 12 weeks of work in front of us just to get through 1A and 1B. I think that that's absolutely reasonable. And then I know that Dr. Fauci has come on record saying that sometime in March, probably by early April, that's when we're likely to go to phase 2. And phase 2 is when we go to general population vaccination. So just so people know, I kind of feel like a good analogy is when you're on an airplane and you know that everyone deserves to take off. You just kind of want to know, are we third in line or are we 30th in line? You're okay with it. You just want some information. So that's probably what people are looking at. Now, there were reports that came out yesterday about there being more vaccines in the vials. The vials are supposed to have 5 doses, and some of these have 6, 7, even 8 doses. First of all, some people have said to me, hey, is that a problem? Did they not know this? Let me first level set with everyone and let people know that even with the flu vaccine, there are more doses. We know that. It's common. This is not new. So this is not a manufacturing problem. This is something that we know about. Now, lastly, I'll end here. That will mean that there are more doses. And so, yes, to a certain extent, having more supply matters. We know that Pfizer got their emergency use authorization last week. Our expectation is that Moderna could have it as soon as the end of this week. And then in early 2021, Johnson & Johnson, possibly even AstraZeneca, will get theirs. The more supply there is, then the more, product we'll have. And again, to follow up on that point made earlier by Dr. Brennan, we didn't want to be the rate determining step here. We understood that our organizations both have the infrastructure to help in this first phase. But when it comes to phase 2, we want all hands on deck. This is not a time to be competing with one another. We've got to do the right thing. We have to come together. When we have the supply and everyone working together, we'll get the country vaccinated.
Well, I think you've all given us a lot of confidence and a lot to think about. I really appreciate the public service messages here. And now I want to give one more that's slightly off topic and ask Wes Wheeler this. What can we all be doing for our UPS drivers? Our UPS driver at my house brings us dog bones every day. What do they want? They're tired of Christmas cookies. What nice thing can we be doing for our UPS guys and gals?
Well, there's about 300,000 of them. So there's a lot of us out there. We've got 3,000 pilots. They're the unsung heroes right now because they're getting FAA special clearance to land on airports full of snow. But you can't get to the pilots. You can get to the drivers. And I can tell you, they're all very, very proud to be part of this, down to a person. So anything, I think just a simple thank you. They're not allowed to take much more than that. Please give them a thank you. I think incredibly proud. We're all very proud to be part of this. Hundreds of thousands of UPSers anxious to deliver the 200 million, 300 million doses of vaccine required, and perhaps more than that. But we're prepared. We've got plenty of capacity. Don't worry. We're on the job. We're working today, and we're going to make this happen. And I'll tell General Perna that you're all very, very anxious to see this happen.
And how appreciative we all are to everybody at CVS, at Walgreens, at UPS for everything that you're doing for us. And I feel like what we really need to do is let you get back to work and stop yabbering at you. So I am so appreciative to all of you for being with us today and hope you'll come back. Dr. Brennan could be our first three-peater. Could be really cool. So, really appreciate your time today, gentlemen. Thank you very much.
Thank you very much.
Happy holidays to you. Thank you.
Turning to the audience quickly, if you've missed any of our previous discussions, you can find them at uschamberfoundation.org or on YouTube. As we say every time, stay safe, wear a mask, get your flu shot, wash your hands. And just a point of editorial privilege today, this marked our 66th episode and some 20 million viewers. It's been a remarkable run. And I want to thank Mike Carney and Hillary Crow and their whole team in the foundation. And of course, Greg Kundoff and Mickey and everybody on the event side. It's been a lot of work and I think a lot of joy. And It's made all of us feel that there's something we can do to make a difference and find meaning at this time. So take care of yourselves and each other, and Happy New Year.
This message isn't for everyone. It's for all those people who refuse to wear a mask. You know, lying in isolation in ICU for 7 days, I thought about how wrong I was to remove my mask at the White House. Today, I think about how wrong it is to let mask wearing divide us, especially as we now know you're twice as likely to get COVID-19 if you don't wear a mask. Because if you don't do the right thing, we could all end up on the wrong side of history. Please wear a mask.